Tuberculosis, or TB, is a serious infectious disease. It usually affects the lungs. TB is caused by a bacterium called Mycobacterium tuberculosis. This bacterium spreads through the air. TB can be a silent disease. People can have TB without feeling sick. This is called latent TB infection. Latent TB can become active later. Active TB makes people sick. TB is treatable. Early diagnosis and treatment are crucial. With proper care, people with TB can recover. TB spreads through the air. When a person with active TB coughs, sneezes or talks, tiny droplets are released. These droplets contain the TB bacteria. People nearby can breathe in these droplets. This is how they get infected. It's important to note that TB is not spread through touch or sharing food. People with active TB need to take precautions. They should cover their mouths when coughing. They may need to isolate themselves to prevent spreading the infection. Tuberculosis usually affects the lungs. This is called pulmonary TB. However, TB can also affect other parts of the body. This is called extrapulmonary TB. Extrapulmonary TB can affect the lymph nodes, brain, spine and kidneys. It can also affect the bones and joints. Meningitis is a type of extrapulmonary TB. It affects the lining of the brain and spinal cord. Pericarditis is another type. It affects the lining around the heart.
Tuberculosis, commonly known as TB, is a significant global health problem that affects millions of people across the world. It is a contagious disease caused by the bacteria Mycobacterium tuberculosis, which primarily affects the lungs, but can also impact other parts of the body. TB does not discriminate. It affects people of all ages, genders, and backgrounds. However, certain populations are more vulnerable to contracting the disease due to various risk factors. Some individuals are at a higher risk of getting TB due to their health conditions or living environments. Understanding these risk factors is crucial for prevention and control. People with weakened immune systems are particularly susceptible to TB. This includes individuals who are undergoing treatments that suppress their immune system, such as chemotherapy for cancer. One of the most significant risk factors is HIV infection. People living with HIV are up to 30 times more likely to develop TB due to their compromised immune systems. Another group at increased risk includes people with diabetes. Diabetes can weaken the immune system, making it harder for the body to fight off infections like TB. Malnutrition is another critical risk factor. People who are malnourished have weakened immune systems, which makes them more vulnerable to TB. This is especially concerning in regions with high rates of poverty and food insecurity. Close contact with someone who has active TB is a major risk factor. Family members and close friends of TB patients are at a higher risk of contracting the disease due to prolonged exposure. Living in crowded conditions, such as urban slums or refugee camps, also increases the risk of TB. Overcrowding facilitates the spread of the bacteria from person to person. Healthcare workers are at risk of TB due to their frequent exposure to patients with the disease. They must take precautions to protect themselves, including wearing protective gear and following strict infection control protocols. These workers are regularly exposed to TB bacteria, especially when handling samples in laboratories or treating patients in clinical settings. People who work in high-risk environments such as prisons or homeless shelters are also at higher risk. These settings often have higher rates of TB due to close living quarters and limited access to healthcare.
Inside the infection, the biology of tuberculosis, TB bacteria are inhaled into the lungs. They reach the tiny air sacs called alveoli. The body's immune system tries to fight the bacteria. White blood cells called macrophages engulf the bacteria. However, TB bacteria are tough. They can survive inside macrophages. They can even multiply inside these cells. This can lead to the formation of granulomas. Granulomas are small nodules that contain the infection.
Recognizing the enemy symptoms of tuberculosis. TB can have many symptoms. Some people have no symptoms at all. Others may have mild symptoms that last for weeks. A persistent cough is a common symptom. People with TB may cough up phlegm or blood. Other symptoms include fever, chills, and night sweats. Weight loss, fatigue, and loss of appetite are also common. It's important to see a doctor if you have these symptoms. Early diagnosis and treatment are important.
Section 7, Seeing the Unseen, Imaging in Tuberculosis Diagnosis. In this section, we delve into the critical role that imaging plays in diagnosing tuberculosis, a disease that primarily affects the lungs but can also impact other parts of the body. Imaging tests are used to diagnose tuberculosis. These tests are essential tools for healthcare professionals, providing them with visual evidence that can confirm the presence of the disease. Chest X-rays are commonly done. They are often the first imaging test ordered when tuberculosis is suspected. They can show abnormalities in the lungs. These abnormalities can include a variety of signs that indicate the presence of tuberculosis, such as infiltrates, nodules, or masses. Cavities are a common finding on chest X-rays. These cavities are essentially hollow spaces within the lung tissue, which are caused by the bacteria that lead to tuberculosis. These are empty spaces in the lungs caused by tuberculosis. The presence of cavities can be a sign of advanced disease and may require more intensive treatment. Pleural effusion is another finding. This condition occurs when fluid accumulates in the pleural space, the area between the lungs and the chest wall. This is fluid buildup in the space between the lungs and chest wall. Pleural effusion can cause significant discomfort and may require drainage to relieve symptoms. CT scans may be done for a closer look. These scans provide cross-sectional images of the body, offering a more detailed view of the lungs and other structures. They provide more detailed images of the lungs. CT scans can reveal the extent of the disease, showing the size and location of cavities, as well as any other abnormalities that may not be visible on a standard X-ray. This detailed information is crucial for planning the most effective treatment strategy for the patient.
Section 8. Confirming the suspicion diagnostic tests for tuberculosis. Tuberculosis, commonly known as TB, is a serious infectious disease that primarily affects the lungs, but can also impact other parts of the body. Early and accurate diagnosis is crucial for effective treatment and control of the disease. Several tests can diagnose tuberculosis. These tests are designed to detect the presence of the bacteria that cause TB or the body's immune response to the infection. Each test has its own advantages and limitations, and the choice of test may depend on various factors, including the patient's symptoms and medical history. A sputum test is one of the most common. This test involves collecting a sample of sputum, which is the mucus that is coughed up from the lungs. The sample is then sent to a laboratory for analysis. It involves examining a sample of coughed up mucus. The sputum sample is carefully examined under a microscope to look for the presence of TB bacteria. This method is known as sputum smear microscopy. The sample is checked for tuberculosis bacteria. If TB bacteria are found in the sputum, it confirms the diagnosis of active TB disease. This is done under a microscope. In addition to microscopy, the sputum sample can also be cultured in a laboratory to grow the bacteria. This process, known as sputum culture, can take several weeks, but provides a more definitive diagnosis. The sample can also be cultured to grow the bacteria. Culturing the bacteria allows for further testing, such as drug susceptibility testing, which helps determine the most effective antibiotics for treatment. A blood test can also be done. Blood tests, such as the interferon gamma release assays, IGRAs, measure the immune system's response to TB bacteria. It looks for antibodies to tuberculosis bacteria. These tests are particularly useful for detecting latent TB infection, where the bacteria are present in the body but not causing active disease. Antibodies are proteins made by the immune system. They help the body recognize and fight infections, including TB. The tuberculin skin test, or TST, is another test. This test involves injecting a small amount of a substance called tuberculin into the skin of the forearm. It involves injecting a small amount of tuberculin under the skin. After 48 to 72 hours, the injection site is checked for a reaction, such as swelling or redness, which indicates exposure to TB bacteria. The size of the reaction helps determine if the test is positive or negative. Each of these diagnostic tests plays a crucial role in identifying TB infection and guiding appropriate treatment. Early detection and treatment are essential to prevent the spread of TB and to ensure the best possible outcomes for patients.
Section 9. The Fight Back. Treatment of tuberculosis. Tuberculosis is treatable with antibiotics. Treatment usually involves a combination of drugs. The most common regimen is called RIPE therapy. It consists of 4 drugs: rifampin, isoniazid, pyrazinamide, and thambutol. RIPE therapy is taken for several months. The first 2 months are the intensive phase. The remaining months are the continuation phase. Each drug in the regimen targets the bacteria differently. This helps to prevent drug resistance.
Section 10. Complications and challenges. The long road to recovery. Tuberculosis treatment can be challenging. The drugs can have side effects. Some common side effects include nausea, vomiting, and liver problems. It's important to take the medication as prescribed. Skipping doses can lead to drug resistance. Tuberculoma is a potential complication. It is a mass of dead tissue that forms in the lungs. Respiratory failure is a serious complication. It occurs when the lungs can no longer provide enough oxygen.